the fibula or calf bone is a leg bone located on the lateral side of the tibia, with which it is connected above and below. It is the smaller of the two bones, and, in proportion to its length, the slenderest of all the long bones. Its upper extremity is small, placed toward the back of the head of the tibia, below the level of the knee joint, and excluded from the formation of this joint. Its lower extremity inclines a little forward, so as to be on a plane anterior to that of the upper end. It projects below the tibia, and forms the lateral part of the ankle joint. Structure: the bone has the following components: lateral malleolus, interosseous membrane connecting the fibula to the tibia, forming a syndesmosis joint. The superior tibio-fibular articulation is an arthrodial joint between the lateral condyle of the tibia and the head of the fibula. The inferior tibio-fibular articulation is formed by the rough, convex surface of the medial side of the lower end of the fibula, and a rough concave surface on the lateral side of the tibia. Blood supply: the blood supply is important for planning free tissue transfer because the fibula is commonly used to reconstruct the mandible. The shaft is supplied in its middle third by a large nutrient vessel from the fibular artery. It is also perfused from its periosteum, which receives many small branches from the fibular artery. The proximal head and the epiphysis are supplied by a branch of the anterior tibial artery. In harvesting the bone, the middle third is always taken and the ends preserved. Development: the fibula is ossified from 3 centers, one for the shaft, and one for either end. Ossification begins in the body about the 8th week of fetal life, and extends toward the extremities. At birth the ends are cartilaginous. Ossification commences in the lower end in the 2nd year, and in the upper about the 4th year. The lower epiphysis, the first to ossify, unites with the body about the 20th year. The upper epiphysis joins about the 25th year. Function: the fibula does not carry any significant load of the body. It extends past the lower end of the tibia and forms the outer part of the ankle, providing stability to this joint. It has grooves for certain ligaments which gives them leverage and multiplies the muscle force. It provides an attachment points for the following muscles. History: etymology: the word fibula can be dated back to c. 1670 to describe a claspable brooch, c. fibula euro, and was first used in English for the smaller bone in the lower leg c. 1706. It derives from Latin fibula, also meaning a claspable brooch. The bone was so called because it resembles a clasp like a modern safety pin. In other animals, because the fibula bears relatively little weight in comparison with the tibia, it is typically narrower in all but the most primitive tetrapods. In many animals, it still articulates with the posterior part of the lower extremity of the femur, but this feature is frequently lost. In some animals, the reduction of the fibula has proceeded even further than it has in humans, with the loss of the tarsal articulation, and, in extreme cases, partial fusion with the tibia. See also, this article uses anatomical terminology. For an overview, see anatomical terminology. Peroneal references: this article incorporates text from a public domain edition of Gray's Anatomy. Additional images. External links: Anatomy photo, 17 St 1402 at the SUNY Downstate Medical Center, osteocutaneous fibula flap video on youtube.com.